Hi, Dr. Heather Rogers here, and we have gotten so many questions. We just need to do a catch-up to answer some of the questions. So I'm just going to sort of talk through a number of the questions that came in. I love them, keep them coming. I hope I can help you figure out your skincare needs while you're at home. One of the first questions was about what are the right chemical exfoliators for different skin types. And if you have really oily skin, you can't beat salicylic acid. If you have dry skin or sensitive skin, alpha hydroxy acids are going to probably do a better job for you. The queen of the alpha hydroxy acids is glycolic acid, but there's a lot of other good ones in there. And sometimes a low percentage of lactic and glycolic and mandelic can be a wonderful, gentle way to exfoliate your skin. Another question was about if we're going to continue with our product launches. Yes, we continue to hope to make that happen, and we're doing everything in our power to still be able to launch our body wash and our body cream this fall. What about vitamin C and glycolic acid during pregnancy? So when you are pregnant, your blood vessels are dilated, which means that your skin is going to have more blood going through it, which makes you look flushed, gives you that beautiful pregnancy glow, but also makes your skin more sensitive. So if there was a vitamin C that you tolerated while you were not pregnant, it may be irritating for you when you are pregnant. So in general, less is more during pregnancy. Maybe a 10% glycolic acid, and then you want a gentle vitamin C. I mean, I talk about it a lot, but the Skin Better vitamin C product or antioxidant, it's called Alto, is great and really well tolerated even by people with sensitive skin. Do you need to wean yourself off of hydroquinone? The short answer is no, you don't, but you may have a flare of pigmentation if you don't continue to be meticulous. So you don't need to wean yourself off the medication, but you do need to maintain really good strict habits to keep you from making more brown, which is using at least 10% up to 20% zinc sunscreen. Reapply every 2 hours if you're outside, and if you stop the hydroquinone, you do want to use other ingredients that lighten and brighten your skin, like glycolic acid, like tretinoin, to make sure that that brown doesn't come back. Other questions that came in were about cystic acne. If you have cystic acne, unfortunately, there's really nothing that can be done that works as well as taking oral medication. And you really need to see your dermatologist and talk to them about Accutane versus antibiotics versus something called spironolactone. Spironolactone is amazing for hormonal acne. And you know if you have hormonal acne, if it really comes in sort of waves, or every time, the same time in your cycle is when you get the acne, and it's usually down around your mouth and jawline, then oral spironolactone can be super helpful for you. Another question that came in is, what age should you see a derm and start with a skincare regimen? This is really person dependent. If you have acne at 14, you should go see a dermatologist, because you don't want to have cystic acne scars that you have to deal with for the rest of your life. If you're somebody who's really proactive, come in your 20s to figure out what you can do to slow the aging process. It's much easier to prevent something from happening than it is to clean it up afterwards. And if you have no family history of skin cancer, if you don't have very many irregular moles, if you're somebody who's blessed with just really normal, healthy skin, you may not need to go see a dermatologist as early as somebody else. So we're here to help. In general, there's always something you can learn from a doctor's visit. And I do think people over the age of 18 should plan on seeing their dermatologist once a year. If you have a personal history of skin cancer in the last couple of years, you should see your dermatologist at least twice a year. And see them once, see what you think about it, see if they're able to answer your questions, and then take it from there. Thank you again for paying attention. Thank you again for staying home. I am back at the office taking care of skin cancer patients, and it's amazing how happy the patients are to be out of their house. It's been really cute. I've had a lot of virtual hugs, and people be like, I want to hug you. Thank you for taking care of me. Of course, we're not hugging, and I'm masked and gloved when I'm in the room with the patients, but it does feel good to be able to help people with some of their anxiety.